Hello. Thanks for taking some time out of your busy schedule to learn a little bit more about MARA elbows. We get a lot of questions in regards to what's the appropriate size elbow you need to order. We want to make sure you're getting the right thing and you understand what you're getting. So please hang with me and we'll learn something new today. So we're going to get started with our standard size elbows. These are the ones on the right. When we talk about standard, we're referring to the anterior-posterior relationship. Okay? So our most popular elbow is our medium-sized standard elbow. Our anterior-posterior relationship is approximately 17 millimeters, and then the medium elbow's height or depth, gingival to incisal, is approximately 10 millimeters deep. This is what we use on most of our MARA appliances that we deliver. And what we do is we'll take this, insert it into the appliance, we're going to make the appliance, and then we cut that elbow to its appropriate size. So for example, you can see here we have a MARA showcase model that has the 2 millimeter shim, which should be on all delivered MARA appliances, and you have about 2 millimeters of that elbow protruding from the distal of that large tube. This allows us to do two things. It allows us to add an additional shim, or we can remove a shim if necessary without having to adjust that elbow. If you need to, then you might need to use a new elbow when you continue to advance that. But that's kind of how these should come set to you. If you notice here, we have a trimmed elbow that would have gone into the other side of this appliance, and that one is roughly 12 millimeters long. So we've removed approximately 4 to 5 millimeters from that elbow. So with that being said, let's move on to the small elbow. So the small elbow, which is our second most common, is often used in cases where we have short clinical crowns or the bite hasn't opened up as much as we anticipated. This elbow is approximately 16 millimeters from anterior to posterior relationship and 7.5 millimeters in depth from gingival to incisal. Now, I know that it's hard to see these on camera, but it's a lot more there's a lot more difference between each one of these in the real world than what you're seeing on the camera. And then last, what we're going to look at is the large elbow, and this is used when we have a posterior open bite or when we advance the bite and it tends to open up more than we anticipated. This one is approximately 18 millimeters from anterior to posterior relationship and 13 millimeters deep from a gingival incisal. So with all of that being covered, those are our standard elbows. Now let's look at our extended elbows. The extended elbows are the same as from size to size in regards to the depth of it. So the small elbow is going to once again be 7.5 millimeters from gingival to incisal. The medium is going to be 10 millimeters from gingival to incisal, and the large is going to be approximately 13 millimeters from incisal to gingival. The difference is the length. We've added an additional 7 millimeters to help for additional advancement if the doctor has ran out of room on their standard size or whatever elbows was delivered with the appliance. So once again, a much longer AP length here, and that's going to help you put on some extra shims as well. Sometimes we use this when we're trying to engage with the lower cams and we're having troubles to do that as well and need a longer elbow. But that's about it. I hope you have a great day. Thank you for taking the time. Take care.